So first we will see the definition of mechanism of labor. It is a series of movements that occurs on the head in the process of adaptation during its journey through the pelvis is called as the mechanism of labor. We will see the presentation and flexion and all in the LOA position, that is the left occipito-anterior position. So in left occipito-anterior position, suppose this is the maternal pelvis and this is my left side. Okay, so in left side the occiput of the fetus is present. So this is the left occipito-anterior, which is mostly present at the iliopubic eminence. In this, the lie of the baby is longitudinal and the presentation is cephalic, and part of presentation is vertex, and the denominator is occiput. Now we will see all the steps in the mechanism of labor. So first is engagement. In engagement, the fetus head is fixed in the brim of pelvis. Second is descent. Descent is a continuous process which happens throughout the labor process. The third is flexion. Flexion happens due to the regular descent process or due to the resistance from the pelvis floor. The flexion of fetus head occurs. Suppose if this is the pelvis floor, due to continuous descent and due to the resistance of pelvis floor, the fetal head gets flexed. Okay. Now after flexion, the third is internal rotation. Internal rotation happens so that the smallest diameter of the fetus head gets passed through the pelvis. So this is the LOA position. Now due to internal rotation, due to internal rotation, the occiput of the fetus is behind the symphysis pubis and the face of the baby sweeps the perineum. Okay, due to internal rotation, as the baby's head is rotated internally, the body remains at the same position but the fetus head is rotated, and due to the internal rotation, the torsion of neck forms. Now after internal rotation, there is extension of head. Now before that, that is residing and crowning. Now residing in this, the baby's head is just behind the vulva and you can see the presenting part, and in crowning, with or without the contraction, the fetal the presenting part is fixed. Now our baby's head is delivered out with the extension is in this way. So now you can see the fetus occiput escapes the pubic bone through the behind the symphysis pubis. Now after extension of head, to relieve the torsion of neck, the baby's head is passively rotates to relieve the torsion of neck. Now after that, there is delivery of shoulder. For delivery of shoulder, the anterior shoulder comes behind the symphysis pubis. So internally the shoulder rotates, and externally you can see the baby's head is also rotated. So now when you will see the external rotation of head, that means internally the shoulder is rotated. Now, so for the delivery of shoulder, the anterior shoulder sweeps the symphysis pubis, and the posterior shoulder, after delivery of anterior shoulder, the posterior shoulder sweeps the perineum. After delivery of shoulder, for the delivery of trunk, lateral flexion takes place. After delivery of the